Hello, my name is Dr. Stephanie Southard. I am a primary care family practice doctor. Currently work at Wayne County Hospital in the Rural Health Clinic, and just want to talk a little bit today about my experiences with hospice. My first exposure to hospice was when I was a small child. I was probably around age 6 or 7, and we had hospice come into our home with my sister. She was 4 years older than I was and had been diagnosed with a heart disorder. She actually had congestive heart failure and was having a decline in her condition, and the doctors felt that hospice was an appropriate avenue for her, and they actually came into our lives through her, and it was something that we were a little scared about at first. We didn't know a lot about hospice. We didn't know what kind of services they offered. We didn't know what it meant when the doctor said, I think we need to call hospice in. We knew that she was sick. We knew that, that she had a lot of problems and then had been fighting a lot of health battles. But we really, not being in the medical field at that time, we really didn't know what path was ahead of us. Hospice came in and answered a lot of questions for us. They were a big means of support. At that particular time, we were living in Louisville, and they had a volunteer in the program that was designated just for me. That person came and did special activities with me. Actually took me maybe on little, I wouldn't call them exactly field trips, but took me on trips, maybe out to eat or maybe to see a movie or something like that, just to kind of give me a little time away from the not so normal situation that was at home. But there were also people that were definitely there for my parents. They provided an extreme amount of support that even the doctors couldn't do. Doctors are wonderful, obviously, but sometimes they are very much focused on what's happening in the office and what they see right in front of them there, and they care about what happens at home, but they just don't have the time or the opportunities to help with things that happen in the home. And hospice does. They have those capabilities. They have the staff. They have the volunteers that are able to spend time with you in the home, and they can sometimes identify needs that the doctors can't, or they sometimes identify needs that maybe even the families didn't realize they had. They can help with, you think about things like they help with supplies, they help with medications, they help with this, but just knowing that you have somebody that you can call 24/7, no matter what the question is, no matter how small you may think the problem is or how insignificant you may think that your question is, somebody's going to answer that phone, and you're going to get some help, or you're going to get an answer. And even after my sister passed away, hospice stayed with us. They were with us for the next year, and would have even stayed longer if we had wished for that. But definitely through that next year, they were a good means of support, of helping us grieve and helping us know that it's okay to grieve. Not everybody goes through the process the same way, and you don't have to do things a certain way, but we still had that support line there. If we had a question about something, they still were more than willing to come and answer questions and help us with things. And as I've gone on through life, of course now I am a medical doctor myself, and I've had the opportunity to utilize the services of hospice with a lot of my patients. And I will tell you, this hospice is very good about not only working with the families, but working with the physicians as well. They are a very good source to make that link between the patients, patients' families and the doctors. Sometimes people get a little bit antsy or a little bit nervous about asking doctors questions. And first of all, you shouldn't do that. You shouldn't be antsy about that. Doctors are just people too. We're just people too. But sometimes when you're in the office, you don't always think of all the questions that you have, and hospice is a really good source to help get some of those questions answered if it's something that needs to be answered by the doctor. And they're very good with working with the doctors about getting medications that the patients need and just helping take care of the patient's needs in general. It's just a very compassionate organization. It's a very caring organization. A lot of times in healthcare, people get the impression that everything's very cold and very sterile, that people are just known by numbers and not by names. And that's not the case with hospice. Every member of that staff is going to know you. They're going to know your name. They're going to be familiar with your needs, and they're going to do everything they can to help fill those needs. A lot of people are scared when they hear the word hospice. But they think that hospice means death. And it doesn't. Hospice actually means life, and it means adding to your life and adding to the quality of your life. It means more days of being able to be more active. It means more days of having less pain. It means more days of being able to spend with your family. They don't stop the disease. They can't stop the disease, but they can make your time a more quality time. It is a wonderful avenue that we have that is greatly underutilized, and I think that's because people simply don't understand what they offer. They don't speed up death, and I think a lot of times people are concerned that that's what that means. And when the doctor says, I would like to have you talk to hospice, I think people think that everyone's just given up and that there's no hope and that no one cares and people are just tired of fooling with things. And that's not the case at all. When hospice is brought on board, as I said, it's a means of improving quality of life. It's a means of helping in multiple aspects and ways that people don't even realize. So I would just say that if you're ever faced with a situation where you're talked to about hospice and where hospice is mentioned, don't be afraid, but be open. Talk to them. Let them answer your questions. Let them ease your fears. And understand that they are there to help give you some peace through those stormy times. But and also, please don't ever hesitate to ask your doctor any questions you have. But as I said, just be open.